Hey, 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 it is Sunday. So, of course, we have another podcast episode. Last week on our Wellness Advocate series, we had the pleasure of chatting with my friend Megan Cook, and we talked about the importance of professionals seeking out their own mental health support in order to prevent burnout and just promote stress overall. That was such a good conversation. And today, we are kind of getting off on that train of self-care and continuing forward with something a little more creative in the world of self-care and mental health.
I'm so excited.
Kelsi.
So we're thankful today to welcome Jenna. And Jenna, is it Savago? Savago?
Savago.
Savago, I was right the second time. So Jenna, she's a licensed professional counselor, certified clinical trauma professional and art therapist. That's a mouthful, Jenna.
But she's got all the letters.
I love it though. I love it.
I'm still earning the art letter though.
Hey, are you almost there?
Yes.
That's exciting. Good for you. But welcome, Jenna. So if you don't mind, tell us a little about yourself, maybe just about your background, any education, experience, maybe your values, roles, and just a little bit of background about yourself.
So with art therapy, I went to Ursuline College and I graduated the master's program. It's a dual program because in Ohio, you can't do art therapy by itself. So in 2016, I graduated from the counseling and art therapy program. And then I just plugging that into my individual therapy now, putting in art whenever I can, and then using that supervisor to make sure that it's still working good. And just kind of keeping that creative side going, because after a while, even for me, talk therapy is a little too much and I need something fun.
Yeah. So I guess on that note, like what made you decide? Because I know like even, when all of us are deciding on our graduate programs, there's a lot of different options. So was that art program part of the counseling program and that's why you chose it? Or was it just an extra perk?
Like how I chose art therapy?
Yeah. Like what made you choose that?
That's a funny story. I was 3 weeks away from graduating from Kent, had no idea what to do with my life because I did a undergrad in sociology. And I was in a printmaking class and somebody said, hey, do you know that there's an art therapy program at Ursuline? And the next day I applied.
Oh, that's so cool. I love stories like that.
I said, I don't know what this is, but I'm doing it. And then I had to do it was an essay. And I ended up playing with my nephew and he's very closed off and we were playing with chalk and that's what I wrote my essay on because I actually got him to talk to me for once in his life when he was so I was like, we're just gonna do this, we're gonna run with it. So
I love it. Well, okay, but like even still, right, like were you just always, I'm sorry, I'm digging and making it, you're like this wasn't the script, like I need to know, like, because when I'm going to school and someone's like, oh hey, there's this, I'm like, yeah, but I'm not creative, or that's not for me. Like, what were you always creative, or was?
Yeah, I ended up because my minor was in fine art.
Okay.
But I didn't know what I wanted to do, and I had no idea that art therapy existed until 2 months before I applied. So I said, why not? I don't know what I'm doing, and I started to panic. I was about to graduate, and you have to have a master's to do anything in counseling anyway, which I actually didn't want to do counseling at first. I just liked the sociology aspect, had enough credits to double minor with psych and fine art. And I was like, why not? If I don't like it, then I guess I'll stop.
Okay. All right. Thank you. I appreciate you letting me
brought it all together. Yeah.
I did. I was like, I don't know what to do. Oh no, let's try. And then it to work out.
It's a happy combination of all of it.
And you know what, Jenna, you're not alone in that. Like so many people have that same experience. Like I got to third year of my BA in psych and I was like, wait, I have to go to school for like 12 years to be a psychologist? And I can't do anything with this 4-year degree?
Nope. I changed my major 3 or 4 times before, and then I found that I had enough credits, and I was like, let's just throw them all together.
There you go.
Yep.
Okay. So now that we have the background, what is art therapy? Because like you said, you're still even working on your licensure toward it. And I think a lot of people just throw the term out there and don't really know what art therapy is.
Well, I'm going to read you the definition from the American Art Therapy Association because I can't put it in my own words.
Okay, awesome.
So they describe it as art therapy is used to improve cognitive and sensory motor functions, foster self-esteem and self-awareness, cultivate emotional resilience, promote insight, enhance social skills, reduce and resolve conflicts and distress, and advance societal and ecological change. So basically, it's using your whole body to work through, traumas, the difficulty communicating with people, with the anxiety, the depression, like bringing your whole body into it rather than just your head sometimes, because we get stuck up there.
I'm so excited to have you on, Jenna, because I feel like it has like this, art therapy. People think it's like, okay, arts and crafts and talking.
Yes.
And I love how you were like, it's your whole body. There's a whole thing with it that's not just, here, let's do this craft and talk. And that's why when she said like she got you to come and be one of our guests, I was like,
yes. Yeah. And with art therapy, like that's where it gets confusing, because I've given Amanda some stuff too. Like you can do some art pieces and that's like art as therapy, where you just bring it in and it's like, let's do this to kind of just give
as
you
an intervention.
Yeah, like an intervention. But with art therapy, you have to have a master's to do it, because we're trained in how to look at color, how to look at supplies, trigger the person, what's not. Do I need to use this to trigger them? Knowing how to have that cultural competency with specific supplies, what that projective assessment is going to give you, and how that culture brings into that. Like it's a lot of that training of how do I use this material, kind of like regular interventions, but using more of that supply list of I need to know the background of it so I know how it's going to change somebody. Give somebody like clay if they're going to be triggered because of like a childhood trauma. I want something different before getting to that.
That's so smart. Yeah, like just the same way that we're going to make sure that we avoid certain, words, or, even just like things like a touch, right? Like even just like a little like touch on, okay, don't touch anyone because they've had trauma or anything.
Smells.
Smells.
Yeah, that's also a big thing.
I know that we're going to get to the mindfulness part, which I'm excited about, because we started talking about all those things. But so you kind of mentioned like traditional therapy, you could use art interventions, right? But art therapy, how does that completely differ than traditional therapy? Like, why would if I'm going to go to therapy, like, how would I know the difference, and why might I want one over the other?
A lot of it has to do with the debriefing afterwards, because of training. And I tell people when I'm doing it anyway, it's out of research and like based in like all of the stuff that's pretty common, but it might not be the same thing for you. So like something as simple as you put this tiny figure up in the upper right-hand corner of your picture. That means something about regression or looking into the past versus looking towards the left, or, your house tree person, your tree isn't grounded or your house isn't grounded. So there's something going on with boundaries or being able to feel secure. And like watching not only how the person is using the materials, what they're struggling with, but also what comes out of it, and having that dialogue rather than just be like, oh, you drew this, what's that about? Okay, cool, let's move on. It's, I noticed this, does that have any significance for you? And then digging it apart that way.
Whereas that might happen in traditional therapy, but not with an art intervention.
Right.
That might happen.
And there's some that you can look at, but it's more about the debriefing part of it and just breaking it down and being like, okay, this is typically, what this color means, or, you didn't draw your fingers on your hands. Like, what does this mean? Is that a regression thing? Kinetic family drawing will help show like family systems rather than just, oh, I don't get along with my dad. Like, did they put it in a box? Did they put this boundary in it? Are they not even there? Are they on the back of the page? Like all these different things to look for.
It's such a unique, oh, sorry, Amanda.
No, I just want to like take her brain and have it.
I know. I was like, it's such a unique way of, bridging into those kind of topics and trauma and stuff. Cause, with talk therapy, sometimes getting to that place of, that debriefing just happens right after that intervention compared to in talk therapy, it can take probably a good while to get to that at a pace where, the client's comfortable. It's like a very, I don't know how to word like what I'm thinking. I'm not saying it's faster, because your intent is not to be quick.
It's a more direct way.
Thank you. I'm like,
Yes.
it's very efficient and, you know, a different approach to getting there with them, you know.
And it's also, yeah, it's a good way. Sometimes I'll ask to keep them or have them bring them back, and we can bring it in later and be like, do you remember when you did this? What do you see now?
That's very cool. Okay.
Yeah.
So Jenna, when we started talking about the mindfulness topic, can you give us some examples of how you incorporate like the whole body mindfulness into your work with your clients in art therapy?
It depends on where they are. Generally, a lot of the beginning ones, it's using like scribble drawings, or, you know, taking a deep breath in, picking a color that whatever you're feeling at that time, you know, happy, sad, angry, whatever, closing your eyes and just scribbling it out. You know, sometimes just that connection of this is how I'm feeling, I'm putting it on the paper, and then we're going to look at it and be like, oh, you know, you got some pretty loopy ones, you're doing all right, kind of thing. Normally, if it's like hard, rough scratches, there's like some serious kind of feels going on, and breaking it down. So almost just like mindfulness of just getting into the body, because it's that awareness of right now, what's happening to me, rather than, you know, you ask somebody sometimes, how you feeling today? I'm fine.
Yes.
Yes, you look fine. Let's see what's actually happening. And even it is a kind of a mindfulness thing just in general with any task, because you're looking at it and reflecting back on yourself, because it's not about what you draw, what you sculpt, what you create. It's the process you went through. The product gives us a lot of information, but we get more information of you actually being involved in it than anything else. And more information being involved in it because you're active and you're not as like shut down or as passive, depending. I mean, you can tell that too.
Okay, Jenna, I'm going to put you on the spot again. When we come back, I want you to give our listeners, viewers, like one concrete mindfulness art thing that they could do. Like, even if you describe that breath work a little more or something that they could like leave with that would help them with that mindfulness incorporation. Because I think all the time we talk about mindfulness and people are like, meditation, I don't know, I can't sit and meditate. And so I'm just always kind of trying to give new ideas for what mindfulness truly means. And I think this is a great time to give that. So stay tuned. Jenna's going to give you a tip when we come back. All right, we're back. Jenna, can you give us kind of like a one take thing that people can do today to be mindful?
An easy one I generally will tell people to do, it'll actually pull in a little bit of music therapy without being music therapy, kind of like how we can incorporate that back and forth. Finding a song that really feels into where you are right now, even if it's just like something orchestral. Picking, like it's like before, like picking a color. Sometimes what we'll do is pick the color of what you're feeling right now. Say you're feeling really low or really down, because generally when we're trying to get into the mind or meditate, like something's going on and we need to kind of recenter. And just kind of closing your eyes, and you just kind of scribble along with the music. See what comes out of that, because you're not only using your listening, you're using kind of your whole body to pull it together and just kind of scribbling that through. Depends on how long you want to go through. Some people only do 30 seconds, some people do the whole song. And then kind of looking at it for a minute and just kind of seeing like, do I feel like really tense, or how do I feel after kind of getting that out? And then sometimes I'll tell people to then do it again with a song that's maybe something more calming for them, and pick a calming color, do that again, and just you're kind of working through kind of that tension that you're probably feeling. So it's not like you're sitting here trying to clear my mind. I'm just feeling, because really you're going to be focusing more on the music itself and the coloring that you're doing, basically, more than this is what I'm frustrated about, or I need to stop thinking. Because you tell yourself to stop thinking, it's not going to work.
Yeah.
Looking at the two and seeing like, how do I feel after doing both of these? Like, just kind of some fun little scribble that you did. And it's not about making a picture, because that just adds a whole bunch of insecurities. It's just, I let all of this feeling out. And that's kind of the same thing with like the mindfulness, is I'm just letting it out and I'm being present and I'm being aware. And sometimes using some other forms rather than just, I need to sit here and quiet. That way.
I love
just noting.
Like doing the follow-up one with like a calming color, and then because you listen and you pick the song and what am I feeling right now, and then you're helping yourself kind of go back to an equilibrium with like a calming but still acknowledging what it was that you were feeling. Cool. And you
Kelsi, I need to interrupt real quick because I just noticed.
Oh no.
Kelsi's got her leftover breakfast there. Kelsi's joining us from Mexico today, guys. That's how committed she is to the podcast.
That's last night's room service and this morning's.
Classic.
So jealous.
I like it.
So jealous. Sorry, I had to interrupt and say, like, if you haven't figured it out yet, why Kelsi's in this beautiful room right now. She's relaxing in Mexico.
Yeah.
You said we're dedicated, so sorry, I did not. And there's nowhere else to put it, so. I'm not hungry today. I just ate.
So, I mean, even with the mindfulness side of it, anything like a background of mindfulness, it uses those three main functions of relaxing the body, being aware, and then regulating emotions. So when you're adding the art to it, it's helping to access those deeper emotions that sometimes you can't verbalize, right? And it's a cathartic way of release is usually because you're doing something with it. Sometimes talking isn't enough. And it's a visual language. So it's another way of looking at it. So sometimes if we see things, hear things, write things,
yeah.
It makes it more kind of concrete for us to work through. And then it's just, it helps with a mental shift as well, because it's a different way of looking at it. Because art also uses a different hemisphere, a different side of your brain. So you get to jump over and then bring that all back together. So rather than just using one side of just the thinking, you're using the creative side and then bringing them both together and using more of the mind together as well. So even though you're getting in your body, you're also using that giant brain that we have to function everything through.
The whole body, right?
Yes,
we're all about
whole
that.
Body.
Yeah. A lot of people, when we think about stress and trauma, and I think one of the biggest things with mindfulness is we are acknowledging like just how much stress, trauma, the pandemic, all of these things, they literally make us kind of disconnect from our body. And, so like bringing both of those things together in a safe way, and it helps kind of.
That kind of makes me have a question too, because I know a lot of times when we ask people to get into their body or when they finally settle, that's the scariest time. And that's when they're trying to seek out all those unhealthy coping skills or things that they've been doing that aren't so helpful. So do you think with art therapy in your experience or in the research, does that happen less, you think? Or just as much you're just being aware if something is triggering someone? Or
it can be, but that's kind of also the other purpose of being trained in that, to be able to guide them back out of it. Using those materials and like, hey, this is starting to trigger you in a negative coping. Let's acknowledge it and be like, hey, this is kind of what's going on. It's not that you're losing it. It's just this is happening. Let's try something different. I mean, it definitely is going to happen because you're getting them into their body, and that is a hard thing to be. It's easier to be in your head because then you can ignore things. But it's having that training to be like, I'm noticing that you're starting to get a little triggered, or you're starting to get comfortable, and figuring out, is this something that we need to push through, or we need to back off and do something different? Let's do something else that's more soothing for the body to show, oh, I can be in my body and it's okay.
It's safe.
Teaching them that they can modulate themselves. And so, and I know like when we, on the surface, if we don't have a lot of information about art therapy as an intervention, you hear a lot of people say, but I'm not creative, or I'm not good at art. And I know we heard you a few minutes ago say like, it's not about producing a whole picture or a whole piece or something like that. But what would you say to somebody, if they would say, art therapy is not for me, I'm not creative, or I'm not good at art?
Then I say that's completely fine. And I think it's a prerequisite sometimes, would do in groups. I'm like, that's fantastic. You've already made it. You've made all the standards. You went through. It's time. It's helpful, but also I noticed that it's sometimes you're looking at it differently when you're trying to create a product. You're looking at the end result, not the process. It's helpful because you feel like there is a sense of confidence there, but it's really just mostly, hey, it's not about what it looks like. I mean, we can definitely help you figure out how to use these mediums more and these supplies. But even I tell them I'm not an artist either. I do stuff, but I'm not that big into it. And at the end of the day, if you go to an art museum, there's things on there. It's like a white piece of paper on the wall, and that's considered art. I mean, it doesn't matter. It's subjective. If it makes sense to you, then it makes sense. That's all I'm looking for. And people still get caught up on it because you're always, especially in groups, you're looking at everybody else's, but focusing on this is what came out of it versus, oh, this looks great. I don't think I ever say like, oh, that looks really good. I stay away from that because it's not about saying whether your piece is good or not and critiquing it. It's about debriefing it afterwards. It's about.
Do you ever use that as like what you just said resonated so much with me, Jenna, because I feel like I've been through this with so many clients of that limiting belief or that unhelpful, like negative parenting schema that they got out of their childhood of like, I must achieve, I must do well, I must be perfect. Or so do you use that as an opportunity sometimes, like even maybe on individual level or a group setting to say, hey, let's break this down. Why do you feel like it has to be perfect? Or
even just doing that and then also bringing it in like, why is there one specific way this has to look? It happens a lot with doing an intervention with house tree person because it's very personal. It's very about the person. So I'll always bring up, have you ever looked outside and noticed every tree is perfectly placed? Why don't they all look the same? Why not? And they can't come up with an answer. And it's like, okay, I bet you anything, if we look hard enough, we can find a tree that looks like that one, and just bringing that back down into that awareness.
So good. I just want to hang out
in my head. I was like, this is so cool. I want to do more of it.
Can we just like hang out all day? But no, really, I mean, it is super cool. And I value what you do so much, Jenna. I mean, I come to you all the time because I have clients that are artsy. Like I have one client that is their medium. That is how they cope. That's how they get it out. And I'm like, I want to be more supportive. Like I can say, that's great. Oh, that's amazing. Great job being cathartic and using, your medium to cope. And then I'm like, Jenna, what else can I do? Right. Like, and she'll say like,
Jenna.
Right. So then, obviously I ask my client permission, but I'll kind of send stuff over to Jenna and say like, what do you think about this? And she'll be like, oh, that mouth is like this. I would ask them that. And why did they start here? And why is there a blank expression in the eyes? And I'm like, whoa, I wouldn't have even thought of that. I'm like, oh gosh, that sad face.
Right. And it's more about just, this is kind of what the research means. And then you not using it as art therapy, just using it as a way to be like, oh, I'm going to bring this in later. And just kind of, I know that, like you use it as the talk side of bringing it in with knowing like this, like if you read an article or something, oh, let's see how we can fit this in rather than being like, I see these eyes, what's happening?
Exactly.
Yeah. And then, even just telling them like, hey, that's really great. And, what does this mean to you? Rather than doing that debriefing, that kind of keeps you out of that gray zone.
And then what do you say? She's like, these weren't questions. What do you say? Like, would it be beneficial to someone to go to traditional therapy if they don't have someone that's an art therapist too, but like go to traditional therapy and then adjunct with art therapy?
You can. Most art therapists are trained in traditional therapy because you can't have one without the other.
Right.
It breaks down to insurance.
Yeah.
Well, because you can't bill for art therapy yet. You can't. Because we don't have that coverage, that technical licensure over in the state of Ohio. So you actually have to be careful with how you're billing it. So you could, but that's the good thing about art therapy is it works really well by blending the two.
Gotcha. Okay. All right. And then I think that's going to be one of your last minute announcements there. But any last minute like tips, advice, something that you like, this is your platform, get it out to the world. Someone 20 years from now might listen to this podcast, right? Like what is something you want to get out to the world, or any last minute tips? Or
just do it.
That's like
search for what is helpful for you. If it doesn't work, move on. I mean, that's a huge thing that I tell people all the time, but find something. If you're creative and that's a way of getting it out and you don't need that art therapy piece, then stay with traditional too. I mean, it's your way out and it's set for you. But if, there's so many different things out there, finding someone who has that kind of ability to jump through the different ones, like the music, the art, the talk therapy, the certifications, it's going to be best for you, and utilizing those professionals that, hey, this isn't working, refer me somewhere. Don't be afraid to ask.
I love that so much. Like, that's so concrete. Like, if it's not working, move on.
Yeah, don't internalize it. It's, it's not the whole it's you, it's me. It's not it.
Yep.
Take what you need, leave the rest.
Yep.
Anything else, Jenna?
I mean, no, there's a bill going through that we're trying to pass. I don't know what's happening with it.
Hey, we're social workers, so we're all about advocating. What is it? What do you need us to vote for?
It's a bill. It's through, I don't even know where it's through right now. I'm blanking. It's SB 238. It's to regulate licensure for music and art therapists, because like I said, you can't bill for it. So what they're trying to do is make it more regulated, have like a state form of ethics rather than just the Art Therapy Association, because it's recognized, but it's not state recognized. So like, we do so much. We can't just be art therapists. We have to be counselors. And some will actually let their art therapy like their credentials, their license lapse because they can't do anything with it. Other states will have that. Like, some people are just strictly art therapists in other states, but Ohio, you can't do it. Not right now.
Okay. So we're just
the training and the credentials, the certification, but you don't have like a full on like backed license, like counseling board or social work board. So we're trying to regulate it.
What is our action step? Is there a link you can send us for that Senate bill, or like that we can post?
Yeah.
Okay, cool.
Yeah, I know that they just presented to the Senate a couple weeks ago, so I don't know. With COVID happening, everything got stalled, so I don't really know where it's at right now. They did it a couple of years ago and they just missed the cutoff, so they're trying again.
Okay. Well, we're rallying for you. Send us a link or something and we'll post it with the video and the podcast.
Sounds good.
Jenna, thank you so much.
Yeah.
I'm so glad you were able to come. You're always welcome back to talk about anything you want.
Okay.
And we will be here next week. Oh my gosh, I'm so excited next week. Jenna, I don't know if you ever met Tiara. I don't know if you were ever on that dip rotation. I know we're going back to old jobs together, but
no,
Tiara
I wasn't.
Is a beautiful soul. She is an amazing Black woman in the therapy community. She's a licensed independent social worker too, and she's doing big things. So next week we're talking about mental health, the Black experience. Like, needs to be talked about. So important. Cannot wait to have her here. So stay tuned. Kelsi, you gonna be our promoter today?
Sure. To make sure that you like, subscribe, and all the things, share, invite your friends, because we are super excited to keep, putting good things out there and sitting down with all of our community wellness advocates.
And if you don't subscribe, you don't know when the next episode is.
Yes.
All right. Thanks, guys. Kelsi, go enjoy the ocean. Jenna, go draw something. I'm going to go cuddle my fur babies. We'll see you guys next week.
Yes. Bye.
Bye.